We're on the back nine of 2025, but it always feels like we're just getting started around here on this thing called the Just Start the Conversation. It's brought to you by St. Luke's Penn Foundation. As always, I'm joined by my friend Amie, Alanson, Dundon. Amie, how are we today?
I'm very well, thank you. How are you, Crockett?
I am excellent, and you should be feeling like double the fun, like double mint gum here, because
Yeah.
we've got Amie squared today.
What a great guest today.
I know. We're Amie squared here. Amie Maurizio is the Director of Operations for Substance Use Disorder and Recovery over there at St. Luke's. Amie, thank you so much for joining me today. How are you today?
Well, thank you for having me. I'm excited to be here.
We're excited to have you. So I guess we'll kind of just jump right in on this one because, as always is the case, we exchange our pleasantries in the beginning and want to jump into a very serious conversation here. And we're going to be talking today about substance use and self-awareness. And Amie, Alanson, Dundon, I'm going to have to really be specific here when I'm talking to you two. Amie, Alanson, Dundon, I know self-awareness is one of those things that we talk about quite a bit in this podcast, specifically when we're talking about the need to feel like you need to go and get help in whatever it is the situation is that you're in, to go ahead and do that. Amie Maurizio, I'm going to start with you on this one. When I say what does self-awareness mean in the context of substance use, how would you say self-awareness plays a role there?
Self-awareness plays a huge role when you're talking about substance use and the journey toward recovery. And oftentimes individuals struggle with self-awareness when they're in their active addiction. And in many cases, it takes family members, friends, possibly treatment for individuals to really become aware of their own behaviors, of their emotions, and how those things impact the individuals that are close to them in their lives. Just like anything, whether you're talking about mental health, substance use, or just life in general, it's so important that we're aware of ourselves and our behaviors, emotions, our words. And it's a journey, and it's not something that people typically have initially when they're starting off with their substance use and journey to recovery.
Amie, Alanson, Dundon, pivot. I want to talk to you a little bit about some of the things that Amie had just mentioned there. In particular, kind of, we want to focus on self-awareness, but there's a lot of role players in all of our lives, people that are around us, whether that's significant others, family, friends, maybe the people that we're hanging around with that are possibly bringing us back and forth through this cycle of addiction and trying to get into recovery and kind of that back and forth winding road that can go there. The people, the role players, kind of like I mentioned there, the role that they play in all of this for someone who is going through recovery and how they could either be the positive end of the coin or the negative end of the coin.
Yeah, so you're supporting staff. I mean, you're supporting, like if you're in theater, this is your supporting actors, right? We're like you as the addict or alcoholic are the main character, and then you have all these people playing these supporting roles. And to your point, sometimes the people in our life are triggers for us that can actually perpetuate our substance use behavior. Maybe there are people we do drink with, or there are people that tend to get us emotionally heightened, which then triggers us to go out and use substances. And conversely, our supporting characters can also be very supportive and be the ones that help us to get sober and stay sober one day at a time. So it's very important when we talk about self-awareness to know the role that the people in your lives, your cast of characters, who are they for you? And are they positive or negative influences? Are they helping your recovery journey? Are they hurting it? And very often, especially in the beginning of your journey in getting sober or clean, denial's powerful, right? So it's easy to say, oh, well, Joey and Jeff and Susie are great people for me, because I don't really want to look at the fact that, I love them and they aren't probably good for me. And sometimes it's very difficult, and we need an outsider, sometimes somebody that's maybe a mental health counselor or a doctor or a recovery coach or a peer specialist, to be able to come in and say, let's look at the reasons why these people may actually be hurting your recovery. It's often very hard to look in the mirror and see reality. I talked in some of the work that I've done previously, somebody taught me that really when you're first in recovery, it's very much like standing in front of a funhouse mirror, right? So you're looking in this mirror and it's very distorted. And what you're seeing, the image of yourself, takes a long time for that image to become clear and not be that kind of funhouse mirror distortion. And it takes a lot of work, and often it's the people in your life that aren't going to be your best supporting characters as you start your journey.
Amie Maurizio, I kind of want to come to you with one of the points that Amie Alanson Dundon just made as I give your full names.
I'm Amie IE and she's an Amie Y. So we could do that
too, but then it was like out of context. I'll go, we'll change it up as we roll through. Amie with a Y. See, that just sounds so. Anyway, one of the things that Amie IE just mentioned is that I like this statement that she said. Denial is powerful, and she mentioned friends like Joey, Jeff, and Susie. What a group! Do you think when it comes to denial, people who are in the throes of addiction and trying to get into recovery maybe underestimate how much they actually are using? Like, oh, this is just kind of a, I know when I'm in bad shape, I know if I get to that point, but in reality, they already are in that space.
I think in a lot of ways, individuals do know how much they're using. I think we find that people often overestimate how much they're using, especially when they're seeking treatment and we're trying to gauge appropriate levels of care. Oftentimes, what we're being told they're using and what they're reporting, really they wouldn't be on the phone with us. They would likely be in a hospital or with alcohol poisoning or things like that. I think where the denial comes in is more surrounding the severity of the substance use and how it's impacted their lives, whether it's their daily functioning, whether it's their job, whether it's their ability to care for their children, be an active participant in their family. I think those are the areas where we see the denial play out more significantly. And when you're talking about self-awareness, it is a journey. It takes time for people to really become aware of not only themselves, but their personality, their characteristics, along with how that interacts with their substance use. And then on top of that, denial is one defense mechanism, but there's many defense mechanisms that exist that individuals often struggle with while going through treatment and seeking recovery. And they tend to go back and forth. They gain some self-awareness, but then these defense mechanisms pop in, which are really a protective factor for themselves. When they become vulnerable and uncomfortable, sometimes these defense mechanisms come into play as a protective factor to make them feel better or safer, which is really, not the reality. But that's what they jump to make themselves feel more comfortable.
Amie Alanson Dundon, I want to come to where she said daily functioning, because as we mentioned those role players, those supporting cast members, maybe that to a person who feels like they have their self-awareness about them as they're going through substance use, maybe as someone who is not engaged in it the same way can look and say, this isn't the normal behavior that we're used to. I kind of want to talk about, again, those role players and the patterns in behavior a little bit that maybe you could notice, that even if you want to say you're self-aware. I will say that was an interesting comment that you had before about that substance users often overestimate their usage. I thought that was fascinating because I think to the I don't want to say the casual person from the outside looking in might say, if you're a loved one, if you see that their patterns, as I come back to that word, have changed, you feel like you're probably, really immersed in this world. And I just thought that was kind of a fascinating point. So, Amie, I'm going to come to you. The idea of patterns, the idea of being someone who is there that maybe is talking to someone saying, I am self-aware. I know what's going on. I know how much I can be casual with this or not, versus I think there's a problem here and we need to talk to a professional about this.
Yeah, that can be a really tight rope to walk for family members and friends, right? Because we don't want to push somebody away and alienate them by calling out what we see often. Family members that live with folks with substance use disorders are often very skilled at walking on eggshells and are often very skilled at avoiding those conversations because they just end in arguments, or they end poorly, right? Or they're just not heard. So the real art is, how do you intervene in a way that's not going to set the addict or alcoholic off, right? And that's difficult. I think that's often where professionals come in terms of, if you're noticing. And again, we said it, I think, on one of the last podcasts with, how do you know if there's something going on with your kiddos, right? And there are signs. We just know that there are signs. People change. People, maybe their spending is up. Maybe they're missing work, or they're going in late, or they're sleeping too much, or not sleeping enough, or their appetite has changed. It could be a million different things, and it's all going to look different for every family and every person, because everybody is a different addict. Right? There's not one prototype for this is what it always looks like. So I think it's about being able to communicate. I come back to my I statements rather than, you're late for work and you're always angry and you didn't come to bed last night. Rather than starting to throw accusations at people, start to speak from your heart and your core and say, I'm feeling worried. I'm sensing, I'm seeing, I'm noticing, I want. If I can speak from my own experience with what I'm seeing with you, it's generally going to be less defended or guarded by that other person, right? So I can notice things and speak from my own experience instead of throwing accusations. That often goes better. But it's really about what is changing, what are you seeing that's a problem? Are there disruptions in their daily functioning that are a big deal for that person and your family? And can I point those out in a way that's going to be heard and not dismissed? And again, when you live with somebody for a long time, that's turned to addiction to cope. It's a family disease. Everybody has learned how to walk around it and cope around it. And so facing it often is when initially things get worse before they get better.
Yeah, and I think, too, to piggyback off what Amie said, I think it goes so long before a family member or a friend or whoever it might be might identify the substance use as a problem. They might suspect it. They might be fearful of addressing it. But I think it is important to come and talk with the person out of care and concern. I'm really concerned, that you've been up all night, you're missing work, that sort of thing. And not the blame, because that's immediately going to put up walls and barriers for that individual. So it's important that we show care and concern, compassion when talking with individuals.
Yeah, and I think along with that is really important, I think, for our listeners to remember that, alcoholism and drug addiction are chronic, progressive, and fatal diseases. So let that sink in for a moment. Any other chronic, progressive, fatal disease that we treat in medicine, coronary artery disease, it should be handled with the same amount of care and compassion and concern as an alcohol addiction. They're both fatal diseases.
I want to I want to talk about someone who is maybe trying to, or maybe who is in recovery, maybe on the other side of addiction. We've talked about it on this podcast before. You're always in recovery. I think that was Dickie Knowles who said that. Like, I'm always in recovery. I'm never recovered. I'm always in recovery. I kind of want to talk about trauma. We've talked a little bit about losing a job, sudden loss of any kind, loss of a loved one, kind of one of those events that could, Amie, to come back to what you said, walking on eggshells, that maybe could trigger someone to return to substance use for coping reasons. Amie, Maurizio, I want to come to you on that. Just the idea of, I guess it's kind of twofold as we continue to talk about self-awareness, trauma and understanding where, if you feel like you need help, you can find that. But also, if it's a situation where it is something in your family, or maybe you're the provider for your family and all of a sudden there's a job loss, or we lose someone significant in our lives, being another one of the people in that corner, that can be helpful. That could be like, hey, I'm here, we're going to get through this together. Just the idea of trauma and the role that can play in using substances.
So one of the things that we really work with people on in treatment, and then also, if it's an individual who, made their journey to recovery, not through treatment, but maybe through a 12-step program or through their church, one of the things that we always really focus on is preventing a recurrence of use. So essentially preparing people for these types of situations, because we all know there's daily stressors and then there's events that create a significant amount of stress for people. And so we want to really equip those individuals that we're serving with the tools to respond in those situations. Certainly how someone responds to a daily stressor is very different than how they're going to respond if they lose their mother, or they lose their job. And so ensuring that they know where to go to get help if they need help, to know at what point they need help. What are their triggers? What are the signs for them that they're heading down a path to a recurrence of use? Are they seeing an increase in depressive symptoms? Are they seeing an increase in anxiety? And where are they at in their recovery? Are they currently seeing a therapist? Some may be, some may not be, but we want to ensure that they have those resources available to them should they need to reach out and seek that sort of treatment. Also, if they have a recovery support group, whether it's a 12-step meeting, whether it's, again, like I mentioned before, someone at a church, or whoever it might be, for them to really lean on and be able to ask for help, and intervene before it gets to the point where they're ready to pick up a drink or use again.
One of the kind of coping mechanisms that you talked about there, and we've talked about this before on the podcast, Amie, is the idea of group work, people who have kind of been in your situation before. I want to talk about the strength in those numbers. As we talk about support, I think immediately most people will think, again, your significant other, your immediate family, your best friends. However, a lot of them may not have had the experiences that you have. The idea of a group setting, Amie just mentioned your church, a 12-step program. The importance of those groups and those people, and maybe people who know what might be triggering you in this moment right now, that can give you, a healthy coping strategy. Just the importance of people who have been down the road that you have been on before versus just, listen, I think it's amazing when you have compassionate and good people who care about you and who want to be there. I also think as we talk about self-awareness, you've got to learn a little bit in that process too. And who better to tell you about that process than people who have been there before. A little bit about the significance of those group scenarios and those people who have been kind of down that path that you've been on yourself.
Yeah, I think one of the things that we know for sure with some really evidence-based research is that, let's just take veterans and first responders as a group of people, right? They are a group of people who have a lot of the same lived experiences or the same trauma, right? To come back to your trauma word. We know that having recovery groups, support groups, therapy groups that are homogeneous, right? Homogeneous. So the same types of people with the same backgrounds are in that group. The recovery tends to be a little faster because everybody in that group is safe in that they know exactly what steps I've walked. They've walked those steps, right? There tends to be safety in numbers when you're reliving and re-experiencing trauma and working towards coping ahead as a group of people that have those shared experiences. There are recovery centers that have specific programs for first responders, for medical doctors or medical providers, for veterans, right? Because they all have the same shared trauma and stressors in terms of their job, right? And their job stress. So it's super important. We know that. One of the, there's an acronym in recovery that we use a lot called HALT, and it's hungry, angry, lonely, tired. Those are the 4 things we don't want to get, right? And the L is lonely. So one of the things that really does often contribute to a recurrence of use is loneliness, which speaks to your question, Crockett, of how important are groups? Well, I would argue that hungry, angry, lonely, tired, lonely's probably the one that's going to get you in trouble the fastest.
Yep.
For sure.
And I think in addition to groups, just creating that connection with whatever works for you. For some people, that might be going to yoga a few times a week. It might be getting involved in a gym or some type of sort of recreational sport like softball or, whatever their interest is. And, that's part of the self-awareness is for people to know what works for them, because what works for me may not work for Amie, might not work for you. And so that is part of that self-awareness process. And again, knowing when you need to turn to those things as well. Amie mentioned before, chronic. Chronic means that, like you had mentioned previously, we're always in recovery, right? We're always working toward our recovery. I always say that, individuals have to be an active participant in their recovery. You don't just go to treatment, leave treatment, and expect recovery to come to you. You have to work for it. And many people in recovery say it's the hardest thing that they've ever done.
I want to talk a little bit about exactly what you just said there, Amie. Always like inaction in your recovery. To your point, to both of your points, loneliness, I feel like could be a really hard element in trying to take care of that. So beyond groups, I want to talk a little bit about resources and kind of healthy coping strategies when maybe it's not so easy to reach someone, or there is a moment, in that moment, something kind of triggers you a little bit. Amie, Alanson, Dundon, I'll start with you on this one. Just some good resources for people, but also, we mentioned softball and yoga and that going to the gym. That's all excellent stuff. But just some healthy coping strategies and also great resources out there when maybe someone who typically is a phone call away isn't necessarily that phone call away in that moment.
Yeah, we're fortunate in 2025 in the United States to really have so many more resources at our fingertips for help than we used to, right? So it depends on where you're listening from and what your community is. But, a good place to start is, it's always my first go-to, is go to your primary care doc. Be open and honest with your primary care doc about your concerns. Right? They're a great place to start because, and also medically, you want to get cleared and checked out and make sure there's nothing going on that as a result of your use that needs to be addressed. Post that, I'm a huge fan of 12-step, the 12-step program. It's international. You can find a group pretty much anywhere and usually anytime, especially now that we've gone virtual. There's a little bit more access to 12-step groups. So AA, Alcoholics Anonymous, Narcotics Anonymous, and then Al-Anon and Nar-Anon. So those are basically 12-step groups for family members. So Alateen. So there are 12-step groups pretty much for anybody. Those are a great place to start as well. And when you go to 12-step groups, I always encourage people, to Amy's point, you have to be an active participant in the groups you're attending. I mean, you can go and listen the first time, get a sense for what it is, but go early and stay after and talk to somebody who has shared something that you found some meaning in. Share your story with somebody. One of the things that we really, really advocate for is getting a sponsor, right? So if you're in NA or AA or you're sober, have somebody with a lot more clean time than you who can be kind of a mentor and who can be kind of your guide as you kind of work the steps towards recovery. Again, that's a lifelong journey. So doing that alone is impossible. So you can find your people and your coping in 12-step. But if 12-step groups aren't for you, there's certainly psychotherapy. There's co-occurring disorder treatment. If you've got maybe depression or anxiety that goes along with your substance use disorder, you can call here at St. Luke's. We've got every level of care for substance use disorder that's available, from outpatient every once in a while to medical, we used to call it detox, right? It's withdrawal management now. But you can find health systems near you wherever you are. And if you need to, you can walk into an ER and you can talk to the ED staff if that's your only door in, right? Or you can call up St. Luke's Penn Foundation, and certainly we can help guide you once we kind of assess and see where you're at and get you connected to the right care. It's everywhere, really. There's a lot of treatment.
Oh, there's a ton of treatment. And I think the one thing that you might have mentioned earlier, Amie, is the certified recovery specialist. That's a really significant role, and not something that has always been around in this field outside of a 12-step program. But certified recovery specialists are individuals who are in recovery themselves, and they go through some training and they become certified to take on that role. It is funded by Medicaid in the state of Pennsylvania, also funded typically by the county drug and alcohol offices. And those individuals can work with individuals seeking recovery. And if they're nervous about going to a meeting, they can accompany them to a meeting. And really their whole goal is to share their lived experience while also helping someone find their own journey. And identifying, what would be helpful for them. So it's an additional layer of support outside of formal treatment, outside of 12-step meetings, that can really help them navigate a system that can be complex at times.
Mm-hmm. Sure. I think that's the important thing to kind of leave this conversation on is whether you are the person dealing with substance abuse yourself, if you are a family member, Amie, I don't know that we've ever talked about those Al-Anon and Ar-Anon. Did I write those down correctly?
Nar-Anon, like Narcotics Anonymous.
Okay, those are for family members that want to try to get some information and
support.
I think that's a beautiful thing. Yeah,
information and support. Right, addiction is a family disease.
Yes.
Period.
Yes. And I think support for everyone in this situation is excellent. And I think there is support out there, like we said, whether it's starting in your immediate household who's behind the doors you live in, or if it's out there in groups or people or settings that can help you have healthy strategies for how to cope. And I think that's a pretty excellent thing. So I think that's a good spot to wrap up on a good positive note there. Amie Squared, you can find them on a live tour, I guess, coming up at 20, 25 U.S. cities, I guess, after this.
Yes. Nice. Can we get T-shirts?
Yeah, yeah,
Okay.
there you go. I'll be the guy who
Swag.
fires them out of
Swag.
the cannon into the
Nice.
crowd. Yeah,
Yeah.
that'll be great. So to both of you, Amy and Amy, thank you both for your time this morning. I think this was a really excellent conversation. So thank you.
Thank you.
Thank you.
It is the Just Start the Conversation podcast. It is brought to you by St. Luke's Penn Foundation. For Amie, Alanson, Dundon, for Amie, Maurizio, my name is Kevin Crockett. Be sure to check this podcast out, sluhn.org, or on our websites for Cumulus Radio in Allentown, or wherever you get your podcasts. We're there, YouTube as well. Thank you so much for joining us for the Just Start the Conversation podcast.